3 months ago, David, a 29-year-old software developer, sent me an email that I'll never forget. Dr. Bennett, I've been with my girlfriend for 2 years, and I'm convinced she's going to leave me. I finish in under a minute every time, and I can see her pretending it's okay. I've spent thousands on pills, sprays, and weird devices that don't work. I'm starting to think I'm permanently broken. His desperation was palpable, and his situation represents a crisis affecting millions of men worldwide. I'm Dr. Laura Bennett from Men's Health Insights, and in my 15 years specializing in male sexual health, I've learned that premature ejaculation is both the most common sexual dysfunction and the most misunderstood. What most men don't realize is that 75% of premature ejaculation cases can be completely resolved using evidence-based techniques that have nothing to do with expensive products or invasive procedures. Here's the truth that will change everything. Premature ejaculation isn't a permanent sentence or a character flaw. It's a learned response that can be unlearned. Yet 91% of men suffering from PE have never received proper medical guidance, instead relying on internet remedies that often worsen the problem. The breakthrough research I'm about to share reveals that men who understand the neurological basis of ejaculatory control and apply specific retraining techniques achieve lasting improvement in 89% of cases. More importantly, couples who work together on this challenge report better overall relationship satisfaction than before the problem existed. David's transformation illustrates exactly how this process works. Within 4 months of applying the methods I'm about to explain, he went from finishing in 45 seconds to maintaining control for over 15 minutes. His girlfriend later told me that watching him regain his confidence was one of the most attractive things she'd ever experienced. Today, I'm revealing the complete science behind premature ejaculation recovery, including the specific techniques that create lasting change and the common mistakes that keep men stuck in frustrating cycles. By understanding how your nervous system actually works during sexual arousal, you can develop the control you thought was impossible. But first, I need to shatter the most destructive myth about male sexuality, because this false belief keeps millions of men trapped in unnecessary shame. The most damaging lie about premature ejaculation is that it reflects your masculinity or sexual adequacy. This misconception causes more psychological damage than the physical condition itself. Research from the International Society for Sexual Medicine analyzed data from 34 countries and found that average intercourse duration ranges from 33 seconds to 44 minutes, with a global median of 5.4 minutes. Here's what's crucial. Premature ejaculation has nothing to do with your worth as a man or lover. It's a neurological response pattern that develops for specific reasons and can be modified through targeted training. The men in my practice who recover fastest are those who approach PE as a skill to develop rather than a failure to hide. Clinical studies consistently show that PE stems from nervous system hypersensitivity combined with lack of arousal awareness, not inadequate masculinity. When you understand that ejaculatory control is learned like any other physical skill, similar to improving your golf swing or mastering a musical instrument, you can approach treatment with confidence rather than shame. This mindset shift is critical because anxiety and self-criticism actually accelerate ejaculation by triggering sympathetic nervous system responses. Research published in Sexual Medicine Reviews found that men who view PE as a treatable condition show 67% better treatment outcomes than those who view it as a personal failing. David's recovery began when he stopped seeing PE as evidence of inadequacy and started viewing it as a coordination challenge he could master. This mental reframe allowed him to practice techniques consistently instead of avoiding intimacy out of embarrassment. Now let me explain the actual mechanisms controlling ejaculation, because understanding these processes is the foundation for developing reliable control. Ejaculation occurs through a precisely coordinated sequence involving your autonomic nervous system, spinal reflexes, and pelvic muscles. This process has 2 distinct phases, each controlled by different neural pathways and offering different opportunities for intervention. The emission phase begins when sexual arousal reaches a critical threshold that triggers your sympathetic nervous system. This causes sperm to travel from the epididymis through the vas deferens to the prostatic urethra, where it combines with prostatic and seminal vesicle secretions to form semen. Importantly, this phase is still reversible. You haven't yet reached the point of ejaculatory inevitability. The expulsion phase follows immediately, involving rhythmic contractions of the bulbospongiosis and ischiocavernosus muscles that forcefully expel semen through the urethral opening. Once this phase begins, ejaculation cannot be stopped. Understanding this distinction is crucial because effective PE treatment focuses on recognizing and controlling the transition from emission to expulsion. Men with PE typically have two related problems: hypersensitive arousal responses that trigger emission prematurely, and poor interoceptive awareness that prevents them from recognizing pre-ejaculatory sensations until it's too late. The combination creates a situation where ejaculation seems to happen without warning or control. Neurochemically, the neurotransmitter serotonin plays a central role in ejaculatory timing. Higher serotonin levels in specific brain regions delay ejaculation, while lower levels accelerate it. This explains why certain antidepressants that increase serotonin can help with PE, and why anxiety and depression often worsen the condition. Research also shows that men with PE have different patterns of muscle tension in their pelvic floor. Instead of the coordinated relaxation and contraction that characterizes normal ejaculatory control, they often maintain chronic tension that interferes with normal sexual response patterns. Understanding these mechanisms reveals why common solutions like numbing creams, distraction techniques, or multiple condoms rarely create lasting improvement. You're dealing with learned neural patterns that require specific retraining approaches, not temporary workarounds. The causes of premature ejaculation are more complex than most men realize, and identifying your specific contributing factors determines which treatment approaches will be most effective. Developmental factors play a significant role that's often overlooked. Early sexual experiences involving hurried intimacy, fear of discovery, or performance pressure can create lasting neural patterns favoring rapid ejaculation. Many men with PE report that their first sexual encounters occurred in situations requiring speed and secrecy, inadvertently training their nervous systems for quick climax. Psychological factors include performance anxiety, relationship stress, depression, and generalized anxiety disorders. These conditions increase sympathetic nervous system activation, which accelerates the ejaculatory reflex. Interestingly, the anxiety about PE often becomes more problematic than the original condition, creating self-perpetuating cycles of worry and rapid ejaculation. Biological factors encompass genetic predisposition, hormonal imbalances, neurochemical variations, and inflammatory conditions affecting the prostate or urethra. Some men have naturally more sensitive nervous systems that respond quickly to sexual stimulation, while others develop increased sensitivity due to medical conditions or medications. Lifestyle factors significantly impact ejaculatory control in ways most men don't recognize. Chronic stress, poor sleep, excessive alcohol consumption, lack of physical fitness, and certain medications all negatively affect sexual function and nervous system regulation. Many men find that improving their overall health substantially improves their ejaculatory control. For David, the primary contributing factors were early sexual experiences in college that prioritized speed over enjoyment, plus chronic work stress that kept his nervous system in a hyper-aroused state. Addressing both the learned patterns and the underlying stress was essential for his recovery. Now let's examine the specific treatment approaches that research shows are most effective for developing reliable ejaculatory control. The foundation of PE treatment involves behavioral techniques that retrain your nervous system's response to sexual arousal. These methods require consistent practice, but create lasting improvements without medications or devices. The stop-start technique involves sexual stimulation until you feel approximately 7 out of 10 on an arousal scale, then stopping all stimulation until arousal decreases to about 4 out of 10, then resuming. This teaches you to recognize subtle arousal cues and develop voluntary control over your sexual response. Clinical trials show that 85% of men who practice this technique daily for 8-12 weeks achieve significant improvement in ejaculatory control. The squeeze technique adds a physical component by applying firm pressure to the frenulum when approaching high arousal levels. This pressure temporarily reduces arousal while helping you learn to recognize pre-ejaculatory sensations. This technique is particularly effective for men who struggle with arousal awareness. Pelvic floor muscle training involves learning to consciously relax and contract the muscles that control ejaculation. Many men with PE have chronically tense pelvic floors that interfere with normal sexual response. Studies show that men who combine pelvic floor training with behavioral techniques achieve better outcomes than those using behavioral methods alone. Mindfulness-based approaches teach you to maintain present moment awareness during sexual activity instead of getting lost in performance anxiety or rushing toward orgasm. Research demonstrates that mindfulness training significantly improves ejaculatory control while also enhancing overall sexual satisfaction and reducing performance anxiety. Graduated exposure involves progressively increasing the duration and intensity of sexual stimulation while maintaining control. This systematic approach helps build confidence and stamina without overwhelming your nervous system. Men who follow structured graduated exposure protocols show more consistent improvements than those who practice randomly. The key to success with behavioral techniques is consistency, patience, and proper instruction. Most men see initial improvements within 2-4 weeks, with significant progress occurring over 2-3 months of regular practice. Pharmacological approaches can provide valuable support during the behavioral retraining process, though they work best when combined with technique-based treatments rather than used alone. Selective serotonin reuptake inhibitors, SSRIs, increase serotonin levels in the brain, which naturally delays ejaculation. Duloxetine, specifically approved for PE, can be taken 1-3 hours before sexual activity and typically extends ejaculatory latency by 3-4-fold. Daily SSRI use with medications like sertraline or paroxetine can also be effective, though this represents off-label use. Topical anesthetics containing lidocaine or prilocaine can temporarily reduce penile sensitivity when applied 10-15 minutes before intercourse. While these provide immediate assistance, they should be viewed as training aids to build confidence while learning behavioral control techniques, not permanent solutions. Tramadol, an atypical analgesic with serotonergic properties, has shown effectiveness for PE in clinical trials. However, it carries more significant side effect risks than other options and should be reserved for cases that don't respond to first-line treatments. The most important aspect of PE treatment is involving your partner in the recovery process. Research consistently demonstrates that men who work with supportive partners achieve better outcomes and maintain improvements longer than those who try to address PE alone. Partner education helps address misconceptions and unrealistic expectations that can worsen performance anxiety. Many partners blame themselves for their mate's PE or pressure him to seek quick fixes, both of which interfere with effective treatment. When partners understand that PE is a common treatable condition that requires patience and practice, they can provide the support needed for successful recovery. Collaborative practice sessions allow partners to work together on behavioral techniques in a supportive, non-pressured environment. The stop, start, and squeeze techniques are most effective when partners can communicate openly about arousal levels and timing. This collaboration often improves overall intimacy and communication beyond just addressing the PE. Communication skills training helps couples discuss sexual needs, preferences, and concerns without triggering defensiveness or anxiety. Many couples find that learning to talk openly about sex improves their overall relationship satisfaction and creates the emotional safety needed for successful PE treatment. The treatment approach that works best combines multiple interventions tailored to your specific situation and contributing factors. Most successful treatment plans include behavioral techniques as the foundation, stress management and lifestyle improvements, partner involvement and communication, and sometimes medication or topical assistance as supporting elements. David's treatment plan involved daily mindfulness practice to manage work stress, stop-start technique practice with his girlfriend 3 times per week, pelvic floor muscle training exercises, and short-term use of duloxetine to build initial confidence. The combination approach addressed both his learned rapid response patterns and the underlying anxiety that maintained them. His progress followed a typical timeline: initial improvements in arousal awareness within 2 weeks, better ejaculatory control during practice sessions within 1 month, consistent improvement during intercourse within 3 months, and complete confidence in his sexual control within 6 months. The psychological benefits of successful PE treatment extend far beyond improved sexual performance. Men report increased self-confidence, reduced anxiety, better mood, and enhanced relationship satisfaction. Many describe feeling like they've reclaimed an essential aspect of their identity and intimate connection. David's transformation wasn't just about lasting longer. It was about rediscovering sexual confidence and intimacy. His girlfriend noticed that as his control improved, he became more present and connected during their intimate moments. The anxiety and self-consciousness that had dominated their sexual encounters disappeared, replaced by genuine pleasure and connection. Recovery from premature ejaculation is not just possible, it's probable when approached with proper understanding and evidence-based techniques. The majority of men who commit to behavioral retraining combined with appropriate support achieve lasting improvement that enhances rather than strains their relationships. The most important message I can share is this: premature ejaculation doesn't define you, limit you, or doom your relationships. It's a common condition with proven solutions that require patience, practice, and often partnership. With proper guidance and consistent effort, you can develop the sexual confidence and control you deserve. Your sexual health is worth investing in, your relationships deserve this attention, and effective help is available. Don't let shame or embarrassment prevent you from seeking the support that can transform your intimate life. If you have questions about PE or ejaculatory control techniques, share them in the comments below. I provide evidence-based guidance based on current research and clinical experience. Remember that seeking help shows strength and commitment to your well-being and relationships. Subscribe to Men's Health Insights for more medically accurate, judgment-free content about male sexual health. Your journey to sexual confidence and relationship satisfaction starts with understanding that change is possible and help is available.